Good afternoon, everyone. Thank you for joining us here today. We are here with the first Tuesday at 2 press conference that we've had regarding COVID-19 since May 18th, I believe. So we had 2 months of very good numbers. And as we all know, there's some issues going on in the country, and unfortunately we're starting to see some increases in our region as well. So I felt it was important that we present the latest data that we have with regards to COVID-19 update in Erie County. Pleased to be joined by Kendra Schmidt from Deaf Access Services. We'll be providing the American Sign Language to all today. Dr. Burstein is not here. She's actually on vacation. But even though she's not here, I felt it was important to provide some of this latest information. So to Dr. B, wherever you are, hopefully you are actually not watching this but enjoying the day somewhere restful. But the latest COVID-19 summary. Through July 26th, so through yesterday, there are 89,862 unique COVID-19 cases. Those are confirmed cases, not repeats, all individuals in Erie County. In the last 7 days, we've had 351 total new cases, which comes out to 38.3 total new cases per 100,000 residents over a 7-day period. And as we go along, we'll talk about how that has increased, significantly increased over the last 3 weeks. Hospitalizations as of July 25th were still very low. 38 COVID-19 patients in Western New York hospitals, of which 8 are in the ICU. 28 of those patients are in Erie County hospitals, only 3 in the ICU, 2 on airway assist. We'll also talk about the hospitalizations. We have seen an increase in hospitalizations, but one thing we haven't seen an increase, thankfully, is in the ICU numbers. So hospitalizations have gone up slightly, but the ICU numbers have not. And when it comes to deaths, we've generally been very good, except we did have 4 COVID-related deaths over a 3-day period, as we'll talk about earlier this week. And it's always sad when you're hearing about individuals who are dying from COVID-19 because at this point it is preventable. But the confirmed cases over the past 6 weeks, we've seen, and you can see, a fairly sizable increase as a percentage, even if it's not a lot of cases at any one time. The total cases have increased the past 2 weeks. Weekly cases have actually quadrupled since the week ending July 10th, though they're still very low compared to winter. So the week that ended July 10th, we had 68 total new cases for the whole week, which is the equivalent of 7.4 per 100,000 residents over a 7-day period. The week ending of July 24th, we were up to 298 cases, and that was equal to 32.4 cases per 100,000 residents. And we've actually increased that number with our most recent data from the days since the 24th. Erie County has now moved back into the moderate transmission level, according to the CDC, from where we were low. Low is anything 0 to 9, and for a number of weeks there, 4 weeks in a row, you see from middle of June to the week of July 10th, we were below 9, so we were considered a low risk of community spread associated with COVID-19. We are now in a moderate risk of community spread, and that is growing. And it's possible, if the trend that we've seen in the last week continues, we'll probably go up to a substantial risk by next week. And it does matter. I'll show you a little bit more. This is the United States, every county as of the week ending July 24th. Yellow, well, blue, let's start with blue. Blue means you are a low risk. That means you have less than 9 cases or 9 or less cases over a 7-day period per 100,000 residents. And you see yellow, which is moderate, 10 to 49. And pretty much all of New York State, except for 1 or 2 counties, is in the low or moderate. And Erie County, up until recently, was in the low category. We're now in the moderate. And then you see those reds and oranges, primarily reds, especially in the South, in which every county in some states is at a high risk of transmission of COVID-19, meaning there are more than 100 new cases per 100,000 residents over a 7-day period. So what you are seeing in a good portion of the United States is exceptionally high transmission rates And it was not like this earlier in the year. Remember, the South had actually been doing better than a lot of other areas based on the recorded rates. And if you look at the numbers now, the South is doing poorly, but so is a lot of other parts of the country. Truthfully, the Northeast and the upper Midwest still has the best rates when it comes to COVID, and a lot of that has to do with vaccination rates because we have higher vaccination rates than other parts of the country. You see a swath of blue going through the Great Plains. One of the reasons why it's so low in most of those areas is there is a very, very low percentage of people that live in those counties. Some of these counties have 100 or 200 or 500 people in the whole county. So some of those counties have very, very low population, which means you're going to have very, very low risk of transmission if you have a county that's spread out over hundreds of geographic miles, but you have a small population. So we're still doing okay in New York State. We're still doing okay to our friends in Pennsylvania that are generally in the viewing area of the television stations here, but the rest of the country is not doing so good. And as I said, based on the most recent day's data as of yesterday, we are currently at 38.3, which is moderate. If we get above 49, we will then be identified as a community in substantial risk of community spread of COVID-19. Now, new cases for the week ending July 24th of 2021. This is broken down by the zip codes. It is still very low compared to where we were last year and during the winter. So I'm very pleased to still see these low numbers. But we have seen it creep up recently. The zip code with the highest cases was the 14215 zip code in Buffalo, which has been a problem zip code all along. After that, you have Amherst, Williamsville, Clarence, Lancaster, Depew. Though if you actually go based on the population per 100,000 residents, Depew, the 14043 zip code, had the highest, followed by Lancaster. Not a big surprise because it's right next to Depew, and part of Depew is actually in the town of Lancaster, and then 14215. Those three zip codes would all be considered under the CDC standard at a substantial risk of community transmission because they're at 50 or above. So those three zip codes, Depew 14043, Lancaster 14086, Buffalo 14215, have a higher rate than basically the rest of the county. You'll see a lot of stars on this and X's. That means they don't have enough cases based on the population to do a true determination of the per capita over a 7-day period. Though these numbers have been increasing, as we said, and I think we had 79 new cases today. So we are seeing an increase in cases, and if that case increase continues, it's possible Erie County by next week will actually be up again in the substantial risk of community spread after not being anywhere near it because we were in the low risk of community spread for quite some time. Confirmed cases by age groups for the last week. The highest age group category, once again, as we've seen for quite some time, is the 20 to 29-year-old and 30 to 39-year-old age category. That's where the vast majority of I shouldn't say vast majority, that's where we are seeing a greater proportion of new cases based on age group as compared to the others. There are children who are catching COVID. They generally do not get sick, but there are children who are catching COVID. And I do know we had some issues with some summer camps in which children at summer camps were tested positive. And so we understand that is a concern. It's a legitimate concern as we finish the summer and head towards fall. Erie County hospitalizations, this is the chart for the last 2 weeks, July 12th to 25th. Overall hospitalizations have tripled in the last 10 days, or nearly tripled, but they're still very low. Now the thing which I was really hoping for, because we continued to see a drop in May and June and early July, is that we got to a point where there were 0 hospitalized patients with COVID in Erie County hospitals. Because we got to 10. I thought maybe we'd get to 0. Well, we didn't. And in the less than about 10-day period, we've actually seen a near tripling of the COVID cases. The one thing that's very positive is we have seen the ICU numbers stay low. Some of the lowest ICU numbers we've ever seen. So those ICU numbers are still very low. That's a good thing. As I noted, there were 4 people who died in the hospital in a 3-day period, 2 on the 22nd and 2 on the 24th. Our Department of Health Epidemiology staff is confirming the residency. My understanding is one of those individuals was not even a New York State resident, but did die of COVID in our hospital. So we'll have better understanding of the individuals who perished since the 22nd, whether they were county residents or not. And once again, 36% of COVID-19 hospitalizations are individuals 64 and under, so it's just not old individuals who are in the hospital with COVID. We are trying to get information on those that are hospitalized any one time, whether they're vaccinated or not. We don't have access to the information. It actually requires us to contact the hospital and have the hospital tell us, which is not something we get all the information. So a lot of people are asking how many people are hospitalized that have not been vaccinated. And the answer as a percentage of it is I can't tell you the exact number. What we've been told by the hospitals is the vast majority of the people who are hospitalized with COVID, like over 90%, were not vaccinated. And the numbers with regards to deaths, which we do have access to, we know everything about the individual, whether they're vaccinated or not, when they die, and we'll get to that in a second. But I do not know the exact number or percentage of individuals who are hospitalized had they been vaccinated or not. We've been told it's over 90%, but we don't know the exact number. Speaking of deaths, there have been 7 people who died through July 22nd in the month of July, after 18 in June. There are unfortunately 1 individual who died under the age of 40 in the month of July, so a fairly young individual died of COVID an Erie County resident. There are 190 individuals who've died since April 1st through July 22nd that were Erie County residents. We can definitively say of the 190 who have died, 182 were not fully vaccinated prior to infection, which is 96% of the deaths. Of the 18 people who died in June from COVID-19 that were Erie County residents, 17 were not fully vaccinated prior to the infection. And of the 7 people who died in the month of July, 6 were not fully vaccinated prior to infection. We are aware that some individuals, when we say not fully vaccinated, they may have had 1 shot, they may have had 0 shots, but they were not fully vaccinated and had the 2-week window after they received their completed vaccine dose. So if you haven't been vaccinated and you're hemming and hawing about it, please get vaccinated. The numbers are very clear. We just saw data that was released by Alabama, data that was released by Louisiana. It's about 96, 97% of their deaths are individuals who were not vaccinated. We see the same percentage here. It's basically the same percentage across the whole United States. So if you've not been vaccinated, if you've not gone through your vaccine regimen, you got your 2 weeks, you are still at risk. You get your first dose out of 2, you're still at risk, especially with the Delta variant. It is quite apparent the Delta variant, the information that was provided to me by our health department staff, is approximately 1,000 times more transmissible than the original COVID-19. It's very dangerous. And it's why at 3 o'clock, we'll be done by 3. I believe the CDC will be issuing a statement that's going to be carried nationwide with regards to mask wearing again. So we do know the Delta variant is in Western New York. We have proof of it here in Erie County. That's been done by the University of Buffalo Medical School, doing DNA analysis. We know the Delta variant is here. And as a result, we know it's much more transmissible. And people are getting sick that didn't think they were going to have to worry about COVID. And as we have this information from our contact tracers, we know people are getting sick with COVID who have been fully vaccinated. They are breakthrough cases. We have breakthrough cases in Erie County. We are 100% confirmed that. These individuals are not very sick. They're not hospitalized, but they are getting sick and they're getting tested, and their tests are coming back positive for COVID-19. So we do have breakthrough cases. The advantage of being vaccinated is it protects you from serious illness and death. So what we're seeing is if you are vaccinated, You can still catch COVID because the vaccine does not prevent infection. It prevents you from getting seriously ill or dying. And we are seeing that in Erie County with individuals who we can look back at their vaccination records after we test that they're positive and see they were vaccinated in May. They were vaccinated in March. And now they're positive with COVID-19. And they've got mild symptoms. They have a fever, they have a cough, they have shortness of breath, but they're not hospitalized. And that's what the vaccine is supposed to do. It's to prevent serious illness and death. If you are unvaccinated, you are at much higher risk of serious illness and death than the larger population that have been vaccinated. So to those individuals who are out there, I certainly hope you'll get vaccinated for our greater community because it gets us closer to herd immunity, but for your own well-being. We've seen the stories recently. Saw the story about the radio individual, the talk radio host from Tennessee who wasn't necessarily anti-vax but wasn't pro-vaccine, denigrated the vaccine, is very sick, in the hospital, and now is telling people to get vaccinated. So if you're unvaccinated, you are at much higher risk of serious illness and death. And as we noted from the death totals, which I'll go back to right here, 96% of the individuals who died between April 1st and July 22nd in Erie County were not fully vaccinated before their infection. Public Health Lab is still doing COVID-19 diagnostic testing. If you are not feeling well, please get tested to know your status. Even if you've been vaccinated. If you're thinking, I've been vaccinated, I'm not feeling well, I got a cough, I got a fever, but I can't have COVID because I was vaccinated, you could have COVID. Get vaccinated. And especially get vaccinated if you traveled recently, including down south, because it is bad in a lot of parts of the United States. They have low vaccination rates in many parts of the United States, which means with the Delta variant, it is spreading much quicker. It is free to Erie County residents. You call 716-858-2929 to schedule an appointment. We are still testing at a number of locations in Erie County. PCR molecular tests, the ones in which we have to take it over to our health lab on east side of Buffalo, on Kensington Avenue. That can take 1 to 3 days, but we can also do a point-of-care rapid test and give you immediate results. So it's available on site within 20 minutes of you actually being swabbed. Both require the same type of swab. We can also take your results from the point-of-care test and use that to do the molecular PCR testing, which is 99.999% reliable. So if you're not feeling well, if you got shortness of breath, you got fever, you lost your sense of taste or smell, even if you've been vaccinated, get tested. Call us at 716-858-2929. We will test you. Erie County residents, we test for free, and we want to ensure that people know their health status. If you are unvaccinated and you're having these symptoms, please get tested. We will determine whether you have COVID-19 or not. Now, good news, our vaccination rates. Our vaccination rates are very good and the highest in Western New York. For all Erie County residents through July 26th, 60.4%, or 555,084 residents have received a first dose. That is equal to 71.5% of all residents aged 18 plus, or I shouldn't say equal to. 71.5% of all county residents age 18 plus have received one dose of the COVID vaccine at least. When we talk about all residents receiving a second dose or a completed vaccine regimen, we're at 515,588, which is equal to 56% of all residents. That includes residents who cannot get the vaccine, basically 0 to age 11. So when you look at all residents 12 and up, so age 12 through age 112, 64.3% of our residents have completed their vaccine regimen. So we're about 2/3 done. We're not completely 2/3 done, but about 2/3 of all Erie County residents have completed their vaccine regimen. That's great news. Thank you. Thank you to all who've been vaccinated. Some people got vaccinated for the first time just in the last few days. Thank you for getting vaccinated. It's going to make a big difference in our community's ability to reach herd immunity and protect the overall community. And it makes a big difference because there are individuals in our community who cannot get vaccinated because of a health issue. And they rely on us to get vaccinated, to protect them. So if you have not been vaccinated and you're hemming and hawing, please do it for yourself and for our community members who can't get vaccinated because it'll help protect them. But these are great numbers. And I wanted to break it down so you saw it on an age range and how well we're doing in some age categories. This is the Erie County one-dose vaccination by age group through July 26th. So the 65 to 74-year-old age category is leading all. Of the individuals aged 65 to 74 in Erie County, 91.7% of them have received at least one dose of the vaccine. Of those 75 and above, it's 82.8. It's not surprising to see it a little lower in the older age category because some of those individuals can't be vaccinated because of health issues. But even in the other age categories, it's really pretty good. 55 to 64, 77.9%. 45 to 54, I don't know what's wrong with you. This is my age category. To the people out there between the ages of 45 and 54, we're actually being beat by the 35 to 44-year-olds. 35 to 44-year-olds, one dose, 70.9%. 45 to 54-year-olds, 67%. So come on now, you Generation Xers like me. Go and get your first dose. And then even on lower age categories, we're over 50% of all people aged 16 to 25 and 26 to 34 have received at least one dose. And when we talk about the 12 to 15-year-old age category, which is the newest one to be allowed to get doses, it's a little less than 50%. So we're doing pretty good on the first dose. And when we look at the second dose, we're doing pretty good on the second dose too. Completed vaccine regimen for those 65 to 74, 86.6%. Over the age of 75, 77%. 55 to 64, 73%. So nearly 3/4 of all people here age 55 to 64 in Erie County have completed their vaccine regimen. Generation Xers, 45 to 54, pick it up. That's my statement to you. I got my vaccine. I'm age, I hate to say it, yes, I'm age 53. But you know what? We got to do better as a community to help protect everyone, and we can do better. That's why I thank everyone who's gotten vaccinated in the last few weeks and even days, because it's making a big difference. We are, as a county, the best in Western New York. Other Western New York counties are lower than Erie County. But because of the density of our population, it really matters that we have high vaccination numbers. So thank you to all who've gotten vaccinated. And when you see it by age range, it really is striking to see how seriously the adults that are over the age of 65 are taking it. They understand they're highest at risk, but those that are even under age 65, a lot of people, hundreds of thousands have gotten vaccinated, and I thank you for it. Now, vaccines, there are three main county vaccination sites. The mass vaccination sites are closed. Key Bank Center, SUNY Erie North, SUNY Erie South, though we have a smaller facility at SUNY Erie South. But the three main vaccination centers are closed. The mobile vaccine teams are traveling to more sites than before. Appointments are suggested, though walk-ins are welcome. You can call 858-2929 to schedule an appointment at a site near you, and we'll talk a little bit more about those upcoming sites, or to call and get one at your home, because we're still doing vax visits, in which you call and we work with our partners, and we'll come straight out to your house and vaccinate you in your home. And when it comes to upcoming vaccine clinics, we got lots of them on our mobile clinics. You can, 12 and older can get the Pfizer, Moderna and older can get 18 and older, I should say, to get the Moderna at any one of the sites that are listed here. Tomorrow at SUNY Erie South, on the 29th and 30th, so the next 3 days at SUNY Erie South, we're at the old DMV building, Building 7. Different times each day. On the 30th, we're also at Hamburg High School. And we're at the East Aurora Boys and Girls Club on August 4th. August 4th, we're also at the Westside Community Services Center. August 6th, we're at the Johnny B. Wiley Sports Pavilion in the city of Buffalo. You can sign up for any clinic. Go to www.erie.gov/vax or call us at 716-858-2929. Now, Erie County masking policies for county employees and visitors. This may change after 3 o'clock, but we'll talk a little bit about this because we've had a couple issues. Fully vaccinated employees. Masks are required in public areas or interacting with the public unless the employee proves to personnel full vaccination by showing their vaccination card or the Excelsior pass. And then if they prove it, employees are entitled to receive a sticker like this one I have here on their badge, which says that they are fully vaccinated. And if you have that sticker, you can get asked at any time if you're entering the building, if you don't have a mask on, do you have the sticker as an employee? You can go in the building without the mask. You can walk around without the mask if you so elect. However, if the CDC recommends vaccinated people should wear masks indoors, then the county will require all to wear a mask regardless of proof of vaccination status. So we instituted this policy with regards to the employees and the sticker about a week ago. But if at 3 o'clock the CDC recommends that as an area we should go into have masks worn indoors totally, then we're going to change it. Otherwise, for partially vaccinated or unvaccinated employees, the masks are required except if they're in a private office or 6 feet or more from other people. And all visitors, regardless of vaccination status, because we do not check vaccination status when people come in, are required to wear a mask at all times, no exceptions. We had a little issue about a week and a half ago in which a couple individuals were led in the building. They did not go through security. They were members of the public. They were unmasked, and they were breaking the rules, among other things that they did, which were inappropriate. But if you're a visitor to any of our buildings and our facilities, and when you're inside the buildings and facilities, we ask you to wear a mask. And based on what the CDC announces today, everybody might be back to wearing masks regardless of whether they're vaccinated as a result of us confirming their vaccination status. Now, businesses and organizations regarding masks. Under the current rules, businesses have a right, organizations have a right to require masks or 6 feet social distancing for employers or other patrons within their establishment regardless of vaccination status. We've gotten some stories of some businesses that are requiring masks and people are entering without masks and kind of making a fuss of it. And the business establishment has the right to set the standard. So please respect an establishment choice of mask requirements. And if you see someone who's wearing a mask, don't mock them. You don't know the reason why they're wearing a mask, even if they're vaccinated. They may have someone at home who is incapable of getting vaccinated because of an immunocompromised issue, and even if that individual is vaccinated, they could be wearing a mask so they don't catch the infection and take it home. So please respect the establishment's choice of mask requirements, as well as please don't mock individuals if they're wearing masks. You don't know the reason why they're wearing it, and the number one reason is to protect themselves and potentially their family as well. Now, before we open up to questions, we have a fun event tomorrow, outdoors. It's the second Erie County Bicentennial Heritage event. It is going to be held at the Roycroft campus in East Aurora. It is the Trailblazing Women of Western New York event. The Erie County Bicentennial Heritage Commemorative Series continues at the Roycroft with the Trailblazing Women of Western New York event, which will include musical performances by Buffalo Girl Choir, Newtown Women Singers, and the Daughters of Creative Sound, as well as a discussion about the impact of women of Western New York have made on social change in our community. Flying Bison Brewing Company will be on site offering beer tastings. Flying Bison, of course, was one of our Shot and a Chaser clinic locations, and I really appreciate their participation. And the Roycroft Inn will be available and open for additional food and beverage. This is free. The event starts at 6. The program starts at 6. The gates open at 5:30. Bring some chairs, bring some blankets, bring your own food and refreshments, and you'll have a fun time as we celebrate Erie County's bicentennial with another event at the Roycroft. I want to thank the Roycroft for all that they're doing. Thank our Erie County Commission on the Status of Women for helping put on this event, as well as, of course, Flying Bison for offering the beer tastings. I was at the first one that they had Pride Night a few weeks ago. It was a tremendous event. It was a lot of fun. I'm going to be at tomorrow's event. It's going to be a fun event as well, and it's open to the public, and it's outdoors, and we're going to have a good time from 6 to 8. So come on down if you're in East Aurora area, and if you just want to hear good music, have a fun time no matter where you are, come on down to the Roycroft. It's a beautiful place to be. And with that, we'll open up to questions, and I'll take one from David first.
Thank you very much, the reason I asked. Come August 9th, the border reopens. You need tests within 72 hours, which means on August 6th, you might get right busy.
The question is, how many tests can the county do in a 24-hour period? The border opens on August 9th, which means on August 6th, we will be pretty busy. We are planning for it. We're expecting an increase in the amount of individuals who are going to be seeking testing due to the border reopening. We're not the only location, of course, that testing is available. There's lots of other locations in Erie County where testing are available. They may not be free in other locations. They will be free to county residents if they contact us. The best thing they could do right now is call our COVID-19 hotline at 858-2929. And if they want to get a test on August 7th, we should be able to start scheduling those tests now. We do have the availability to do a significant amount of tests per day at our locations. I don't know if we'll be able to do every person who wants it, especially if they wait till the end. But the most important thing that they could do is call us to try to pre-schedule a test at that point, because we have multiple locations that rotate across the county, and if we start seeing that there is a tremendous more demand than we even anticipate, we'll put more people on to handle the tests that is obviously going to be sought by many. I want to go to you first. Actually, I think you were in the back first.
Thank you. I'm curious if, COVID data continues to trend in the way it is, or if it gets worse. At any point, do you see yourself requiring mandatory vaccines or testing for county workers?
The question is, if the numbers increase, do I expect to see mandatory vaccine or testing for county workers? This is in reference to what New York City announced yesterday, and some California communities are. At this point, we are not anticipating mandatory vaccines, but if, as I've said, this is a fluid situation. First off, it's a part of what would be considered collective bargaining agreement, so I couldn't just mandate everyone to have a vaccine. That's why New York City is saying either you have the vaccine or you have to be tested. What I think we may end up going back to is full masks in the building, regardless of whether you're vaccinated, and that could change effective as of 3 o'clock. But what I want people to understand is we have really good vaccination rates here. We do know, based on the numbers we received just from the employees who sought the sticker, that we have a very high percentage of our employees who are vaccinated. I don't know the number off the top of my head, but we do have a substantial amount. Not everyone's been vaccinated as our employees, and we would hope that everyone who could get vaccinated would get vaccinated. We know that not everyone can because of a potential immunocompromised issue, and I do know of at least 5 employees, as I've talked about through the last few months, who cannot get vaccinated because of immunocompromised issues. So for us, right now, we are just continuing to push vaccinations amongst our employees. We hoped the incentive of not having to wear a mask in the building would get more people to be vaccinated. I think it did, but now that the CDC may change its rules to protect our employees and the public, we may go back to full mask wearing, except when you're in your own cubicle or you're alone, just to protect everyone. Michael?
Mark, how much do you worry about the messaging that the CDC would be sending by requiring masks if people are vaccinated? Because the idea was always the vaccines protect you, but now because of unvaccinated people, those who have a vaccine require masks.
Now the question is, what message? What is the CDC, if it says and requires a mask again? What's the messaging impact, and what does it say about the people who thought that the vaccine was 100% sort of foolproof, I guess is one way to put it. We know the vaccine is not 100% foolproof because we know people are getting COVID-19 because you can catch it. We've known about that for some time in Erie County. We've had some breakthrough cases here. It's not a big surprise. We've had individuals who've died who've been fully vaccinated. Almost every single one of them had a health issue, immunocompromised issue. My own friend Bob Farmer was fully vaccinated and passed away from COVID after he'd been vaccinated, but he had underlying health issues and was immunocompromised. So I think the message that needs to be sent is we're not out of this pandemic. And the rest of the country, I'll go back to show the picture of the country. It's scary as heck. If you look at some of these states where every county is in the red. Arkansas, Louisiana, Florida is almost all in the red, except I think for one or two counties. Missouri, very high, except for one county. So it's, we saw what the Alabama governor said this past week, in which the Alabama governor basically said this is happening because of the unvaccinated, that they're seeing these skyrocketing COVID rates, they're seeing the hospitalization rates skyrocket because of the unvaccinated. Well, their vaccination rates, I think, are like 35% as compared to ours, which are 70. So the one thing that we've got going for us in New York and in Erie County is we have high vaccination rates. But that doesn't mean you still can't get COVID and you can't get a mild illness even if you've been vaccinated. So I would just tell everybody that if the CDC makes the recommendation to go back to wearing masks, it's based on everything that they've seen over the past few weeks with these huge increases in COVID-19 nationwide. None of us wanted to be here. I did not want to be holding another press conference today, but I felt I needed to based on what we were seeing with increasing numbers in the county and the issues that we were seeing nationwide. So none of us really want to be here. I mean, I don't want to go back to like we were. I don't think we will in Erie County because we have such high vaccination rates. But as I was talking with a few other people lately, we now are talking about the Delta variant. What happens when they start talking about the Epsilon variant or the Gamma variant? And maybe those are even stronger than the Delta variant. And why do we have variants? Because the COVID-19 coronavirus can mutate. And as long as it doesn't, we don't kill it by herd immunity, it's still going to have an opportunity to mutate. The Delta variant did not originate in the United States, originated overseas. Who knows what other variants are going to happen in the future, but I would just say, folks, we're not out of the pandemic. We're much better than we were, but when you look at this map of the United States and see these high rates of transmission in almost the whole Southeast and parts of the Midwest, and you see the difference between the Northeast and the upper Midwest, you can do a complete comparison of vaccination rates and say the reason it's good in New York, Vermont, Massachusetts, Pennsylvania, pretty good, and good in Michigan and Wisconsin and Minnesota is because those states all have high vaccination rates. In the states where they don't have high vaccination rates, COVID-19 is out there and running wild. You are next.
When we look at these vaccination rates in Erie County, I know especially in the beginning when we were getting vaccines, people were able to go to different counties and different states for them. Are those people accounted for? Is there a way of knowing? How do we know that?
Yes, the numbers you see on the screen right now, which is all residents vaccination, first dose, second dose, it is accounted for all residents regardless of whether they got it in Pennsylvania, they got it in Monroe County. It doesn't matter because that's straight from the CDC data. So it's the data from the CDC that comes to New York State that is shared with us. And then when we look at this data here based on age group, same thing. These percentages are all vaccinated, regardless of whether they got vaccinated in Erie County, Niagara County, or for that matter, Michigan. Jeff, you were next, and I'll come back to Marley.
You hinted that, depending on what the CDC says at 3 o'clock, the mask policy could change for Erie County employees in buildings.
In buildings, yes.
Could that extend beyond that, county executive, to other parts of Erie County?
Well, as of right now, it wouldn't. I am in a position to make a determination based on discussions with our health department and personnel that directly relates to our buildings. If we saw a dramatic increase in cases locally such that the hospitalization rate really went up, then we could be talking about mask mandates in other facilities as well. I don't know if the governor is going to institute it again for New York State. He might. We have the ability to do it as a county as well. We're technically still under the state of emergency associated with COVID-19 in Erie County. That has not been rescinded by me. So the state of emergency still exists and allows us to do a lot of things related to COVID-19 that we might not otherwise be able to do. But at this point, it's going to be based on our numbers in our community. The CDC is looking at nationwide numbers, and I think the CDC as well as the Biden administration, fully expected that many more Americans would have been vaccinated by now. I mean, remember, the Biden administration had a goal, I think, of 70% of adults being vaccinated by July 4th, and it didn't hit it. We have hit it in Erie County. 71.5% of all residents over the age of 18 have received at least one dose, and 64.3% of all eligible residents 12 and up have completed their vaccine regimen. That's fabulous compared to the other parts of the country. So just when we talk about whether we'll have mask requirements indoors and other facilities in Erie County, that would be based on seeing rapidly increasing COVID-19 numbers in our county, increases in hospitalizations above and beyond where we are. We're not there yet. I think Marley was, and then Michael.
So you brought up the 14215 zip code as part of the substantial community risk. Yesterday, the governor mentioned it as one of the zip codes that the state's keeping their eye on, with putting funding toward. Any idea of what we could see? I know he talked about organizations going door to door, but the ones he mentioned were specific for New York City. Any idea of what we could be looking at here in that particular zip code?
Well, the question is about the 14215 zip code, which is part of the east side of Buffalo, which the governor noted yesterday has a low vaccination rate and higher cases. As we noted, it's the highest zip code by cases in just total cases, and it's one of the top three in per capita. We're continuing to focus on the 14215 zip code. I had sent over a proposal to utilize the African American Health Equity Institute to basically walk door to door. It didn't get passed by the legislature. We are looking at other measures in which we have the ability to assist right on the ground. We know that the county can't do it alone, the state can't do it alone. We have to have our partners, our healthcare partners like the Health Equity Task Force, the African American Health Equity Task Force, our partners at ECMC, our partners with the federally qualified healthcare centers that exist in our community. And truthfully, people need to talk to their doctors and have their doctors, which are going to recommend to them that they get vaccinated. So 14215 has been an area of concern since we started the pandemic. It was after the first month, it had some of the highest cases. Then it had some of the highest death totals. And we put a tremendous effort in to reduce those death totals and cases, and we did. The problem is when only a certain percentage of a zip code is vaccinated, all those people are at risk who are unvaccinated, and people who are vaccinated still could catch it. So we're going to take a look again and see if there's other things that we can do, even if it didn't get approved by the legislature, to get more people vaccinated in those zip codes. Michael Desmond.
One of the statistics that didn't get mentioned here is positivity rate. Do you have a handle from the tests the county is still doing about positivity rate? And what are you seeing under age 12?
I don't have the exact numbers off the top of my head. We can give those to you because I do have it for the week ending of July 24th. I believe the county's positivity rate is over 2%. But I will get you the exact numbers, Michael. For the week as of the 24th. And under a certain age, we can give you to that too. It's not part of the presentation, so I don't have it off the top of my head.
Because that's obviously, I don't know whether anybody here has kids, but that's obviously an issue in the schools, mask or not mask.
Yeah, I'm glad you brought up about schools and the issue about children under the age of 12 being masked or not masked. Well, children under the age of 12 cannot be vaccinated. There are some testing positive. And I know a lot of parents want to get rid of the mask requirement in schools in the fall. And if these numbers are continuing to go up, I'd be shocked if New York State gets rid of the mask requirement for schools in the fall. It's just, we know that the transmission is spread by respiratory issues. You breathe it in, you can cough it out. You can spit it out. You can breathe it out. You can breathe it in. So what's the best way to protect against a respiratory illness? It's to wear a mask. I don't know what the state's going to do for school starting in September, but if the rates continue to go up and we see transmission among children, and we're talking about the Delta variant, which is much more transmissible, I wouldn't be surprised if the state still required children to wear masks in schools. The best way to avoid that is to get everyone vaccinated so as many are protected. So we are protecting those that are under the age of 12 who cannot get vaccinated. David?
Yeah, I was told by your health department yesterday, of the 190 reported deaths due to COVID-19 that occurred in Erie County from April 1 until present, 46% of those who passed away resided in the city of Buffalo zip code. To your knowledge, was that 14215, that zip code?
The question was, of the 190 individuals who passed away from April 1st due to COVID, 46% of them lived in a city of Buffalo zip code. The answer, to my knowledge, is yes. That is the correct number. The other part of the question was, do they live in 14215?
Yes.
I do not know that.
Okay, and one other thing, the big fire there, where all the PPE.
Yes,
Was that any of your stuff?
The question was, the big fire that took out a significant amount of personal protective equipment, PPE, for area hospitals, including all of ECMC stockpile and a significant portion of Colitis. Was any Erie County PPE in there? Answer is no. We have two separate warehouses, one in Cheektowaga, one in Amherst. It's different from the place where there were fire. And Erie County has offered to ECMC and Callida to help restock their PPE. ECMC had only basically a week's worth of supply left, but we have millions of masks, gowns, nitrile gloves, face shields. So we were able to provide them supply to get them to a point where until they can actually build up their PPE supply again. That's why we have a national stockpile that Erie County does. We say national stockpile. It's called the national stockpile, but it's really a county stockpile. And it's not the only thing we stockpile. We stockpile other things like sandbags for floods. We stockpile pumps. We stockpile food supplies in case of a major emergency where food lines were cut off. So we have stockpiles of all kinds. We have two facilities. The one facility in Amherst is almost totally personal protective equipment, sanitizer, and related entities. So we did not lose any. We are able to offer a significant portion of our stockpile to ECMC and Callida, and that's why you have a stockpile just for this thing. I had a conversation with Tom Cricioci the day of the fire, and I called him up, and his first response is, "You can't make this stuff up." I go, "I know you can't." He says, "You just, of all the things to burn down, the only thing that would have been worse is if it was a stockpile of COVID-19 vaccine." And my understanding, there was none of that in that building. But everything else in there, if you saw the video that I took, you saw the pictures, you saw gloves, you saw masks that were just thrown out as the firefighters were trying to get in there. It was a complete wipeout, destruction of it all. And thankfully, we have a stockpile to help them. Yes.
Two parts to this question. I'm curious, with football season right around the corner and just with the way things are trending, I'm curious if this could potentially have any impact on fans in the Bills stadiums. And then second part of that, just any updates on the coolers at off the stadium.
Two questions. First one was regards, could this have an impact on fans in the stadium? And the answer, of course, is yes, if it continues to grow. Haven't totally figured that one out yet because it's going to be based on the numbers. There are indoor portions of the stadium, and if we see that the numbers are continuing to grow, we may mandate that masks are in all club seats. We don't have that issue right now because there's no fans in the stadium in the club seat areas. But if the numbers continue to grow and based on CDC and Health Department recommendations, we may require masks for everyone in the stadium. That is going to depend on the then current status. As I said, when we pulled back the requirement that everyone be vaccinated to attend a game, that could change. I don't foresee at this point having to require everyone to be vaccinated because our vaccination rates are still high, but if things got really bad, that could change. And your second part of your question is, have there been any additional discussions with the Pagulas? I don't know if you're talking about a new stadium or not. Our Erie County team always has discussions with the Pagulas regarding all kinds of things at the stadium. And when it comes to the football stadium discussions themselves, just say that the county, the state, and the Pagulas are still having discussions. And when we have something to announce, we'll announce it. Mike Baggerman, then Mike Des.
Curious to get your perspective on those who are still hesitant to get the vaccine over the reason that it's, the vaccines haven't gotten full use authorization from the FDA yet. Not sure exactly when that's supposed to happen. I saw somewhere August or January of next year. But do you think that's going to be a game changer once it's fully authorized?
Well, the question was, do you think it'll be a game changer once the vaccines are fully authorized by the FDA for those who've been hesitant? And I think I would hope the answer is yes. Because there are a certain number of people who are saying, I'm not going to get vaccinated until the FDA gives full approval. And it sounds like Pfizer, according to Dr. Fauci, might be getting approval in the next week. He announced that a couple days ago. We've heard that for some time now. We'll see. I think right now there's enough data. The thing that bothers me more than anything is about the false data out there, the false data about the individuals who've died from the vaccine, and that's not true. We don't have cases of that here in Erie County. I saw someone post on Facebook that there's hundreds of people who've died in Erie County who've gotten the vaccine. The answer is there's zero. No. It's just the false information is just as bad as people who might be hesitant and they see the false information on social media and think, well, I don't trust it until the FDA gives full authorization. I hope the FDA would give full authorization by now because more than 100 million Americans have been vaccinated. Just in Erie County alone, we've got over 500,000 have been vaccinated. But to those who are hesitant, if that's what it takes, okay. But I think the thing they need to do is talk to their doctor. If you don't have a doctor, talk to a healthcare professional. There are too many people in our community who don't have doctors. But there's lots of healthcare professionals out there who are willing to talk about this issue. If you don't want to trust me, call our Department of Health COVID-19 helpline at 858-2929. You can talk to an epidemiologist. You can talk to individuals who spent their career in public health, our nurses. And they've all been vaccinated. So I would hope that once the full authorization is provided, those individuals who are hesitant, who didn't want to do it till they got full authorization, will go out and get vaccinated. And trust me, we got vaccine, we'll vaccinate you. Mike Desmond.
You're apparently making health department, at least, some concerns that this is gonna be around for a while. So the health department's about to sign a deal with UB to start sampling sewer lines and testing them, which is kind of a new way of dealing with the COVID issue. Is this kind of long-term planning because the experts keep saying that we're stuck with it?
Questions related to, are we planning long-term to have COVID around? And are we taking actions like we are working with the University of Buffalo on monitoring sewer outflows, which is a program we've been working and testing on for some time? And the answer is yes, we are planning long-term. We are taking short-term action to address COVID-19 in our community, but we're also planning long-term to ensure that we're going to have the resources necessary to deal with what potentially could be around forever. It may be like the flu, that there are variants every year, and you have, like we get a flu shot every year, you might need to get a COVID-19 shot every year, which is based off of the most recent variant. We're planning for it in Erie County. I'd hope that we had herd immunity in our country and across the world and would be able to say it's done, but it doesn't seem to be done. I don't think we're going to be finished with it. I know there's a lot of people who are sick and tired of the pandemic. They're over the pandemic, but the pandemic's not over. Yes. A couple more questions and then we'll end.
What is the new metric that we're trying to achieve then? Or is there one?
The question is, what is the new metric that we're trying to achieve? Well, I think when we talk about the county, we have pretty high numbers of vaccinations. I think what we're talking also about is the country. Herd immunity means nothing in Erie County if we hit to 100%, but we still have states where there are 40%, and people are traveling. We know millions of visitors pass through Erie County on the way to Niagara Falls every year, and they could bring a new variant into our region if they're in our visiting from across the world. I don't have a number on a metric other than we want to get as many people as possible vaccinated in Erie County to protect our community. The same, we want to get as many people vaccinated in Niagara County, Chautauqua County, Orleans, Genesee, Wyoming, Allegheny, Chautauqua, Cattaraugus for the Western New York community. because the more people that are vaccinated in Western New York, the more people will be protected, and there'll be less of a chance of further spread. Last question. Anybody else have a question? Yes.
I kind of have an off topic, but I guess not really, because yesterday I was talking with ECMC, and, they are a trauma hospital as well, but they're also dealing with an increase in COVID patients, and they're running at a very high capacity right now. So with that, I'm just curious about an update on the gun violence in our area.
The question is in regards to, well, it's off topic regarding gun violence, but also how ECMC gets a tremendous amount of trauma victims and also has an increased number of patients coming in for COVID. We are doing, as we announced a week ago, declared a gun violence public health crisis in Erie County. Gun violence has many different aspects to it. Of course, the major one that people think about is homicide. And of course, we've had very high numbers of homicides in the city of Buffalo especially, but also suicides. Often, about approximately 1/3 of all suicides are those people, individual, used a gun. And the statistics show if the person doesn't have a gun, they're less likely to actually commit suicide. We are actually having an internal meeting with regards to the task force that I established to work with our partners to develop additional methods of helping alleviate this as we can in Erie County. We are not the police on the streets in the city of Buffalo. We do provide police services to the Erie County Sheriff's Office, but we have many resources through our Erie County Central Police Services, our Department of Social Services, our Department of Mental Health, our Department of Health, our Department of Probation. So we're sitting down to come up with potentially more ideas to reduce the risk of gun violence in our community. It's tough to watch. I get on my phone updates from our 911 call center through text messages on major incidents, including multiple shootings, big happenings in the county, like the fire that was in Williamsville. And my text messages come at all times. They'll come at 2 o'clock in the morning, they'll come at 4 o'clock in the morning, they'll come at 8 o'clock in the afternoon. And I got so many of them this year about multiple shootings. And it's just maddening because we know that this is a preventable death. These are all preventable deaths. So we are working on it internally, and we're working on helping out our partners as best as we can. It is now 2:58. I know the CDC is supposed to make a major announcement at 3 o'clock. So to each and everyone out there, thank you for joining us here today. I want to thank our members from the media that were here today. First time I've actually been in person in some time. So good to see a lot of people inside the building wearing their masks. I'm about to put my mask on as I go back upstairs to my office to watch the CDC announcement. And the most important thing to everyone else out there, be safe and well. Thank you, Kendra Schmidt, for your service to the community. Take care, everyone.